client was referred to us for assessment. So we chose a couple of different instruments that we could all utilize in our different fields. The first one is called the Clinician Administered PTSD Scale, or CAPS. This is a structured interview that the clinician has with the client. According to our textbook, CAPS assesses both frequency and intensity of PTSD symptoms and assesses the impacts on social and occupational functioning. The next instrument we would use is the Inventory of Altered Self Capacities, or the IASC, to assess the client's areas of relatedness, identity, and affect regulation. This one is considered to be a trauma-specific test, and the different dynamics that are assessed in this test can help create specific goals to fit the needs of the client in each of our treatment plans. The third instrument is the Dissociative Experiences Scale, or the DES. Personally, I would want the client to complete this self-report scale to assess his level of dissociation responses that are sometimes symptoms of PTSD. It is also a good practice to give the DES before using specific treatments like EMDR, because dissociative responses can have an effect on those specific processes. The last instrument that we have chosen to use with our client is the PTSD checklist, or the PCL-5. This is also a self-report, non-standardized test that helps sort through normal levels of distress and clinical levels of distress. So these instruments will be utilized to assess for and diagnose PTSD, and we did not assess for other diagnoses, but further assessment can always be done before adding dual diagnoses.